So today we want to talk a little bit about ICD 11 clinical modification or not. or not. So I briefly talked about this meeting last week, and I promised to do a summary of what was happening and what was going on. So let me see if I could share my screen here so you can see the information. Okay. Okay. So the National Committee on Vital and Health Statistics, one of the cooperating parties of ICD, all of them, just ICD, um, put together this work group, and they've been meeting for a while, at least a year, discussing ICD 11 and what we should do in the US around implementation and policies related to that. So, again, they had this meeting that was open to the public from the work group a couple weeks ago. And here's some information. So, ICD 11 was adopted by the World Health Organization in 2019. Y'all know it's 2023, right? Okay. Okay. It became effective beginning 2022. The three components that they considered or needs to be considered: mortality. US adoption is a requirement of membership in the World Health Organization. Morbidity for US healthcare and public health, and morbidity for US healthcare billing and payment. The US adoption would have to be a HIPAA mandated medical code set, which all of our ICD-10 is HIPAA mandated code set. Some of the previous activities. So, like I said, they've been meeting. Oh, actually, I guess they met prior to that. They started in August 2019. They had the expert roundtable meeting in November. They were evaluating the impact of the different approaches to the transition and implementation of ICD 11 in the US for mortality and morbidity classifications to guide policy and decision making, and also wanted to provide timely leadership on strategic outreach and communication to the US healthcare industry about the transition to ICD 11. So they've been sprinkling some things, letting folks know that it's here, it's out, and we really need to get on the ball. So they also in 2021 recommended to conduct research to evaluate the impact of different approaches to the transition to an implementation of ICD 11, conduct outreach and communicate regularly to the US healthcare industry about the transition. Their overarching goal is to craft recommendations to inform development of sound US policy for the transition to an implementation of ICD 11. Let's see. Develop advice and recommendations to HHS regarding adoption and implementation of ICD 11. Avoid a protracted and costly US transition by developing a shared understanding of lessons learned from the ICD 10 transition and the differences between ICD 10 and ICD 11. They wanted to conduct research to inform a relatively smooth transition, identify work needed to avoid the need for a full clinical modification. So this is where kind of the eyebrows went up, and it's understanding. And I think I talked about this before, where they're really considering whether or not a clinical modification is necessary. And then identify key topics and messages to communicate to the industry to foster early stakeholder engagement and preparation for the transition to ICD 11. And so that is how the meeting started. how we got everything kind of got the ball rolling. And I'm sorry, I left your comments up there. That's how we got the ball rolling. And yeah, that was part of those discussions. Well, I don't know if you know or not, but they also had um, a request for information. I think I shared that. There was a request for information from healthcare entities and organizations. Um, there were, I think, 12 questions that they were asking folks to consider when thinking about the various um, processes, policies, tactics to implement ICD 11. There was a lot of pushback. It took 23 years to get ICD 10. And I think they don't want it to take another 23 years to get to ICD 11. And so it's like, well, what can we do different? What are the learnings from that? And so the work groups, or the members of the work group, and there's several of them, they broke them down into like 8 specific groups, but they also um, touched on the request for information. And so I'll bring that slide up for you as well, so you can see what some of the thought processes, and you can consider, because I think there's another, they're considering another request for information to ask folks to chime in and weigh in on what their thoughts are, because they're looking to engage all stakeholders, and by all stakeholders, it's not just the big organizations, but it's all the way down to the person who actually uses these codes and the manuals. That would be us. That will be you. So you have a voice, and you can feel free to um, use that voice. Use that voice in this. Okay, I'm not finding, what did I do with my slide? Okay, here it is. All right, let me open this up so you can see. Hope everybody is doing well this morning. Y'all quiet today. Any thoughts? I know I don't have my sidekick here who would normally give all kinds of thoughts, but any thoughts? Remember, conversation. We're here. Use your chat. Okay. Okay. Let's see. Can I do? Yeah, I'll do it this way. All right. Change up a little bit. Okay. So this was the information provided on the request for information. And so here are the results. And they looked at all of the results that people turned in. They broke them down. And so initially, here are the questions. Here are the 12 questions. What would be the benefits? What would be the benefits of implementing ICD-11 for morbidity in your setting or organization? That's one thing. The other is, what information or research will your organization need in order to inform assessments of costs, benefits, implementation approaches, communications, and outreach regarding the transition to ICD-11? What considerations affect the impact of ICD-11 on clinical documentation, payment processes, including risk adjustment, public health, population health, or research? Number 4, what unique U.S. coding or terminology considerations are essential? For example, coding or terminology related to community health, social determinants of health, essential human needs, sexual orientation, gender identity and expression, obesity, external causes of injury, and information about mental, behavioral, or neurodevelopmental disorders, including alignment with the DSM-5. Number 5, how should HHS implement ICD-11 in the U.S. for morbidity coding? Number 6, the World Health Organization recommends establishing a national center for ICD-11 implementation. What entity should be responsible for coordinating overall national implementation of ICD 11 for morbidity coding, and how should the implementation be managed? Number 7, ICD 11 uses an open process in which the World Health Organization encourages requests for updates and changes, thus eliminating the main drivers of national clinical modifications. What entity should be responsible for coordinating U.S. requests for updates or changes to ICD 11? How should this process be managed? What resources, tools, or support will your organization need for implementation? What kinds of technical resources, guidance, or tools should the U.S. federal government make available? What workforce planning, or training will your organization need to support implementation? And what are your organization's requirements for ICD 11 mapping to other coding systems and terminologies, including value sets? And lastly, number 12, what other operational impacts of ICD 11 adoption and implementation should HHS consider? So these are some of the answers from those questions. So for the first one, they said enhance alignment and integration with EHR systems and with richer clinical terminology and vocabulary standards such as SNOMED. Increased ability to describe health conditions in greater detail through the combination of codes, facilitating research collaborations, clinical decision-making, accurate reimbursement, risk-adjusted quality measure reporting, value-based and care and payment, and efforts to improve equity by addressing social determinants of health. Someone said the transition to ICD-11 is likely to be more impactful than the transition of ICD-10 by shifting emphasis and capability to post-coordination. That means adding and joining codes to express detail across conceptual dimensions, and thereby introducing new flexibility and clinical precision. ICD-11 provides the flexibility and underlying structure to capture new discoveries in medicine, helping to streamline the code update process, support future expansions, and improve timely availability of data for all use cases. One thing that they mentioned at the meeting was, so for whatever reason, ICD-11 is not just an extension of ICD-10. It's a total kind of rehaul of the code set. And a concern came up about, why are you doing these rehauls every time? and the response was that ICD-11 is kind of designed to stop those rehauls. And so they wanted to create something that this is it. And then when things need to be updated or added, there is an easier way to make those adjustments versus having to have this whole, okay, now we got a whole new platform or a whole new code set that we now need to transition to in order to use for diagnosing procedures, et cetera. And so that is why the discussion around clinical modification is so important, because we use the clinical modification piece for multiple reasons, but primarily the reimbursement piece. And that's why they're talking about this. Some information or research will your organization need? Again, decision on whether a U.S. clinical modification will be developed, and if not, how will U.S. specific coding needs be handled? A comprehensive understanding of the structural and content differences between ICD-10-CM and ICD-11. Information regarding whether HHS plans to provide publicly available mapping software that links its linearization and clinical modification of ICD-11 to ICD-10, CM, and PCS. More detailed information about the nature and scope of these changes, the pathway and transition between versions, requirements, if any, for EHR vendors, implementation of ICD-11, a detailed timeline with milestones and achievable benchmarks. clarity around changes in governance processes, including U.S. deviation from the World Health Organization, research around the benefits, the comprehensive cost benefit around the benefits and costs of adopting ICD-11, including the impact on payment, reimbursement, and new payment models such as value-based care, understanding impacts of ICD-11 implementation on other adopted code sets such as CPT, HCPCS, SNOMED, CT, and LOINC. LOINC, is that how you say that? Expected changes to administrative transactions and workflows, current data storage and transmission, etc. Expected software changes to accommodate ICD-11 in the electronic health record and practice management systems, and estimated vendor implementation timelines and costs. Results from case studies of pioneering ICD-11 installations. They really talked about that a lot. Like, well, what is the information that you're getting from those who have already, from countries who've already adopted ICD-11? And then expected costs for staff training and expected changes to data collection and reporting, including quality measures, value-based programs, clinical research, and other clinical programs. Need to relate. So the next question, what considerations affect the impact of ICD-11 on clinical documentation payment processes, including risk adjustment, public health, population health, and research? Need to relate ICD-11 STEM and extension codes directly to fields in EHR, allowing users to add combinations of STEM and extension codes to track the detailed course of a patient's health status. Relate changes to diagnostic and therapeutic interventions, assess comparative risk adjustment clinical outcomes, and guide healthcare quality improvement initiatives. Updates to a version of the mandated X12 transactions. It's a lengthy, burdensome process that supports ICD-11 must be in place prior to the ICD-11 implementation, along with updates to applicable operating rules. Evaluation of whether the level of granularity of ICD-11 matches clinical, public health, or administrative needs, or whether additional modifications are needed. Consider extent to which ICD-11 coordinates with non-clinical national and state mandated information interoperability content standards, for example, coding used for social services coordination, public health case or surveillance reporting, or quality measures for health equity assessments. All ICD-11 coding specifications related to compliant and complete code generation, displaying, reporting, and billing will be needed to identify tools and platform needs. Need upgraded capabilities to efficiently generate the content creation and to provide the end user with optimal experience with ICD-11. ICD-11 must be implemented properly to better meet various needs, which means adopting and mandating a U.S. version that is more capable than the World Health Organization's MMS alone. All systems and processes leveraging ICD-10 CM codes will need to be evaluated for impact on transitioning to ICD-11, payment systems, public health, social service entities, population health, and research. And will there be consistency across payers in the definitions as to a complete code? That is a great question. What level of post-coordination is necessary to adjudicate a claim? See, again, everybody's voice matters and everybody's perspective matters. Let's see, what unique U.S. coding or terminology considerations are essential? Refine and augment existing social drivers of health and social needs codes to gather data in a standardized way across payers and providers, aligning when possible with the Gravity Project and U.S. core data for interoperability. Consider concepts such as loneliness, lack of social support, military deployment, digital literacy, lack of internet access, and IPV. Current ICD-11 codes may be insufficient for osteopathic and chiropractic providers. Consider requirements and timelines of other mandated regulatory changes and updates, including interoperability standards, the No Surprises Act, HIPAA, standards and operating rules, and TEFCA, etc. Updated versions of the mandated X12 transactions will be needed to accommodate all coding terminology considerations. If the U.S. has unique ICD coding requirements that require either an extension or modification, will the U.S. create its own type of URI to align to the World Health Organization's Foundation, or MMS? Consider need for increased specificity in the area of rare diseases and genetic conditions, and consider governance model to coordinate coding solutions and consolidate terminologies used in clinical practice in U.S. For example, stages of diseases. How should HHS implement ICD-11 in the U.S. for morbidity coding? Well, slowly and carefully was one response. Time frames from 2 years to 10 years. ICD-11 should be implemented only after a clear return on investment is established to show that there is value in using the updated code set for morbidity and that it outweighs the implementation cost. They should develop a detailed roadmap and transition plan with a phased approach. Coordination across all agencies and stakeholder groups is essential. Collaborate with key stakeholders, for example, providers, payers, public health, EHR, health information technology vendors, and professional associations to develop tailored implementation guidance and materials. Provide a comprehensive set of crosswalks or mappings with ICD-10, CM, SNOMED, CT, etc. Consider lessons from ICD-10 implementation, but what are they? Some advocate a hard cut from ICD-10 to ICD-11 based on date of service. Others advocate a transition period during which both code sets could be used. Oh my God, that would be a headache. Okay, I'm sorry. The mandated version of ICD-11 in the US should facilitate access to all entities, clinical concepts available in the ICD-11 Foundation, and national implementation must consideration, which linearization, I can't say that word, will be leveraged. Private efforts are underway to develop a U.S. tailored, again, that word, linearization building on MMS, but other linearization may be useful for specific specialties or setting, i.e. mental health. Okay, let me check in with you all, see where we are, if there are questions, concerns. No, y'all just listening and getting all the tea. Okay, it's cool. What entity should be responsible for coordinating overall national implementation of ICD-11 for morbidity coding? And what entity should be responsible for coordinating U.S. requests for updates or changes to ICD-11? And how should this process be managed? So some of the commenters express differing views. Some advocate traditional approach, relying on the National Center for Health Statistics with input from the cooperating parties, Office of National Coordinator, ONC, or the National Library of Medicine, CMS, etc. Some advocate enhanced role for the National Library of Medicine. They mentioned them a lot on the webinar. Office of Health Data Standards and Terminology, leveraging its role as National Release Center for SNOMED, CT, but with input from other agencies and stakeholders. Some advocate advanced role for CMS, leveraging its role as primary regulator and user of coded data. Consider the creation of a national steering committee or task force with representatives from key stakeholders, including government agencies, professional associations, healthcare organizations, and academia to oversee the implementation process and address challenges, ensuring effective collaboration and representation of diverse perspectives. Structured and transparent process will be needed to align requests with global updates and support timely and clear versioning. And they ask, what tools, what resources, tools, or support will your organization need for implementation? What kind of technical resources, guidance, or tools should the U.S. federal government make available? timely release of policy guidance, develop a specific ICD-11 FAQ section on the CMS website, along with other guidance and public and private sector resources, stakeholder-specific educational webinars, live and on demand, computer-based training, toolkits, training conferences and publications, regular review of industry readiness with an ICD-11 ombudsman at DHHS to address concerns, include an ICD-11 support component into ONC's electronic health record certification program, work collaboratively with industry organizations to develop and disseminate resources, a U.S.-specific browser, especially if the U.S. defines specific requirements of ICD-11 coding, such as for extension reporting, standards or coding guidelines around how specific features of ICD-11 should be used to ensure consistency, such as the use of extension codes, ICD-10-CM to ICD-11 and ICD-11 to ICD-10-CM maps, with NLM's HDST responsible for developing and disseminating the mappings, and consider special needs of physician practices, rural hospitals, Medicaid providers, and plans. They asked what other operational impacts of ICD-11 adoption and implementation should HHS consider. The wide-scale upheaval and significant costs that will occur with the implementation of ICD-11 needs to be closely considered along with expected benefits. HHS should consider other legislative and regulatory requirements and deadlines that will overlap with the implementation period of ICD-11. Healthcare providers have limited resources for updating their EHR and practice management systems, training staff, changing administrative workflows, and sustaining the loss of productivity through an implementation of this large scale. Careful coordination of various regulatory deadlines with changes requiring extensive data and/or IT updates should be considered. Implementing an updated version of the mandated X12 transactions to a version that supports ICD-11 needs to happen before the implementation of ICD-11. Look at lessons learned from the ICD-10 implementation to identify best practices for use with ICD-11. HHS should consider the impact the adoption of ICD-11 would have on pharmacy industry, clinical laboratories, physician practices, rural hospitals, small health plans, etc., and provide support to ease the transition and ensure workforce readiness. Testing requires support, dissemination, learning, and feedback. And the concluding thoughts, the request for information published in the Federal Register launched robust discussion among the key stakeholders and helped set the agenda for the meeting they had in early August. The number and detail provided in comments was limited by the timeline for response. The general tenor of responses suggested cautious enthusiasm with a need for careful attention to many critical challenges, learning from ICD-10 implementation, more planning, research, testing, and evaluation are needed with involvement of all stakeholders. And another request for information cycle may be launched after this meeting, and they talked about that as well, with refined questions and a longer opportunity for response to engage more stakeholders. Because I think they only had like 19 responses. I don't think it was a whole lot. And I know when I got the information, and I think I shared it, it was like days before everything was due. So I think, yeah, they would need to get some more information and get folks out here in the world.
No, I wish. Because and I was all set for this topic because you and I, look, we were around when they introduced ICD-10.
Yes.
And the mess that was.
Yes.
So, and I'm just like, when they say cautiously that cautious enthusiasm. That's what I have, because I don't think it's going to be. I don't think it's going to go the way that they want it to go, because nothing ever does. And I just think that they're gonna. It's almost going to take an act of Congress like it did to get ICD 10 enforced, because they kept kicking that can down the road. So Congress is like, no, no, no.
Like, stop. Like,
you can't do it.
Right. And then no sooner they got it done, here comes ICD 11. Oh, my bad. And no sooner they got it done, here comes ICD 11. And it's like, oh my God, you're going to take the same amount of time, the same amount of uh, putting your heels in the sand to prevent it from coming. Like, get on board, get on board. But to their point, because we use this code set for so many different things, I understand the need. But let me just say this. I don't understand. I know it said that they started this conversation in 2019, but they started the conversation about ICD-11 years before that. So why are we not? Where's the U.S. when the IC in the World Health? Are we still members of the World Health? Let's start there. Like, are we still members? Or is somebody not listening when they start talking in the meeting? Like, this is going on, because I think at some point those conversations we should be past this part. I feel like we should be way past this part in getting information. We should be at the part, where at least policies have been written, mandates, if necessary, have come down. All of that, like it's like it's just now starting from scratch, like it's brand new. It's not in other countries. It's not brand new, sirs and ma'ams. Let's see. What Vicky says, they should first focus on real medicine and health and doing a revamp of the whole healthcare system instead of focusing on the codes and how to expand profit making through them. Well, true. I agree. True. But keep in mind that ICD-11 is not just for us, for the US. ICD-11 is a worldwide collection, because when you hear about the data related to diseases and trends and all of the things, morbidity and mortality is really what these codes were originally designed for. So you would get the statistical information about, you can pinpoint, okay, we're seeing a whole bunch of XY. For example, hate to bring it up, but like with COVID, when they put those codes out for COVID, that's how they can trend and track. We're seeing an uptick of COVID in this area of the world. We're seeing an uptick because this was a consistent codes for COVID that you can easily follow across the world and do the contrast and comparison that was necessary worldwide. We just need, again, as I mentioned before, we special. And so we wanted to add, we felt like, I think at some point, somebody felt like years and years ago, well, we already got this code set. Why don't we put this in with the reimbursement mandate that they got to have a disease in order to get paid, and so on and so forth, and the ball roll? Well, ICD-11 or ICD-10 or ICD-9 without the clinical modification was never designed for that. And that's why the clinical modification came into play. But now they're trying to find a way to really, I think the World Organization is sick of the US. Like, y'all in this foolishness, stop. Y'all delaying these processes. We can't do the needed analysis worldwide because we waiting on y'all. I'm sure we're probably not the only one, but we're probably the biggest one. And like, we waiting on y'all. Come on. Stop playing. And so they're trying to figure out a way around this. And one way that they were talking about in the webinar was these extensions. So having like these extension codes, so it's not a full new code set. It's just like an extension to a companion manual, if you will, that will have like some extension, which is going to be a lot of work for those of us that use this manual. Likewise, I think putting both feet in both areas, trying to code it, that's going to be a nightmare in my opinion. That's just my opinion. Mr. Jesse, what's your thoughts? Let me mute.
Oh, it's definitely going to be a nightmare because we could just never go along with everybody else. We always have to come in and try to change something and make it our way. And it would be fine if we wanted to make things our way and we did it in a timely manner so that we could go along with everybody else. Okay, we're going to go along, but this is what we have going on over here. Okay, we all have decided this day we're going to roll it out. Okay, good. We're ready. We always wait until the last minute and then want to act like we had no idea this was going to happen. I mean, people don't real. There has been access to this code set for like what 2 years now, a little more.
Yes, and I've told people, go out there, look at it, play with it, because it's different. It's totally different, and it's set up for the EHR world, pretty much. It's like database, and so it's set up for the ease of updating into those systems. But there's a method to the madness, if you will. However, you still need to understand how it all links together. And again, because we don't have the clinical modification that we're used to, you can still begin the process of understanding the foundation of it by just going out there and playing around with it and taking a look, because it's been out there for a minute.
The only thing I'm a little curious about and what I'm wanting to see. I'm old school. I need a book.
Oh,
because they're supposedly the beauty of ICD 11 is it's not going to need a book, and it's even bigger. There are way more codes than even ICD 10. So I need a book. That's all I'm saying.
I know, you know me. I write down everything. I'm writing as we speaking. I like validation, and so the book, while I can do and play around with the EHR and assign as needed, I need some black and white validation. And so I know in most of these, or probably all of these, because I haven't looked at every EHR in the world, but they do have the guidelines, and they have all the information in them. It's just a roundabout way of looking for stuff. Like, I'm tired of looking at computer screens. Can I please rest my weary eyes on a book? I think we're doing our health, our ocular health, a disservice by always looking at the screen. That's my own personal opinion. And they ain't gonna have Braille on the screen when we go blind from looking at these screens all the time. So I don't know. I'm like you. I like a book, and hopefully, I know the book producers want a book too, because again, that's a win-win for them. Whatever. I like a book, and I remember. So that was clinical ICD 11, clinical modification or not. And this has been a great session today. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, be safe, and talk with you soon.